So this is an important conversation, and I'm glad we continue to have it. The importance of vaccines is in the spotlight as we commemorate World Immunization Week. It is observed every last week of April. Vaccines have been a matter of discussion since the outbreak of COVID-19. Scientists and healthcare experts advise people to get inoculated as it helps with immunization. Well, let's discuss this further with Nishi Prabdial-Sing, who is Principal Medical Virologist at the National Institute for Communicable Diseases. Good evening, Nishi, and I appreciate your time and sharing your insights with me on this important conversation. I think this time around, I'd like to start local and perhaps expand, go out into the global arena in as far as vaccinations are concerned. Over the years, and I think last year and the year before, government ran a immunization catch-up program. This suggests to me that despite the expansive program that government has run over many years to ensure that children are inoculated, they get at least 11 shots at the last time I checked, there's still quite some ground to be covered.
Yes, good evening to you and the audience. For sure, if the national coverage is not met by the National Department of Health, then there will be catch-up programs for certain age groups so that they are fully vaccinated by the time they reach schools to protect them from vaccine-preventable diseases. So definitely that's one of the ways to control and prevent the transmission of diseases amongst children.
So tell me about the priorities in as far as immunization is concerned in the country. We've been focusing on COVID-19, but as I say, there are about 11 at my last count inoculations that children get through the course of their early years. Which ones are a major priority at the moment?
So children become part of the expanded program on immunization from the time of birth to about 12 years of age. The most important vaccines are the oral polio vaccine given at birth. The BCG for TB is given at birth. And there's a couple of vaccines that are given, either in 1 dose or 2 doses, 3 doses, and sometimes 4 doses. So it's very important to complete the immunization schedule for each child that's born in South Africa and, of course, in Africa to protect them again, from all of these preventable diseases. So during the COVID pandemic, we expect to see a decline in the vaccination coverage due to the lockdowns and due to accessibility and people moving around to clinics and so forth. So we do expect to see that. However, we do implore for mums to take their babies as soon as possible back to the clinics to have their vaccines and catch up on those vaccines that they may have missed.
And how important is the schooling system in all of this? As you mentioned, COVID-19 and the disruptions that it brought about. Part of the disruption was in as far as education is concerned. In that, I saw that there are even guidelines that the Department of Health will issue from time to time for healthcare workers and other people who interact with children to look out for any missed vaccines when they interact with those children. So when children were not going to school, how disruptive was that? And I suppose the question applies even now in KwaZulu-Natal with some of the disruptions we are seeing as a result of the flooding. It's one of those impacts that I imagine are not immediately foregrounded, but actually we should be thinking about them as well in the background.
Definitely. That's definitely one of the catch-up programs in the age groups that should be done, at schools. And the Road to Health card will indicate, which vaccines we actually missed, which vaccines are due to be given. And, and that's definitely something that the school needs to undertake, and understand which ones are really do need to be given as soon as possible. Now that all classes are back and children are attending schools regularly, with the crowded situations and so forth, we really don't want outbreaks of measles or any, highly contagious viruses to spread in school setups. So we really do want schools to come on board and actually look at those road to health cards.
Lastly, Nishi, how do we turbocharge the COVID-19 vaccination program once again? Because it seems to be flagging a little bit.
I think information, people need to just be more informed. They just need to take, informed decisions from evidence-based research. There's so much of evidence out there that the vaccines are working. People need to just have, get to the vaccine, sites and get the vaccines. That's a message that we are giving out, to everybody. These vaccines are going to protect them. It's going to save their lives. It's going to prevent them from going to hospitals. So they need to get out there and, get these vaccines.
All right, there was Nishi Prabdial-Sing there, who is the Principal Medical Virologist at the National Institute for Communicable Diseases, talking all things vaccine. We do focus a lot in the last 2 years on COVID-19, but I thought it's important to remember that actually there are quite a number of other vaccines that young people in particular should be getting and have been getting over the years and decades really, and we shouldn't slack off on those as well.